Hello, this is Crystal Watson, and for this week I have chosen Hildegard Poplau and her theory of interpersonal relations. Hildegard Poplau's theory of interpersonal relations is a middle range theory that focuses on the nurse-patient relationship and how the two work together toward a common goal of wellness. Poplau asserted that the focus of scientific research in nursing should be patients, their needs, and their perceptions about the care they receive from nurses. The purpose of her theory is that the nurses need to understand the importance of how the nurse-patient relationship can help the patient achieve a better understanding of the importance of their care. Once the patient has a good understanding of his or her care, he can continue to work towards wellness without having the nurse constantly help. And by working through a set of phases in a particular order, the nurse and the patient can reach the goal towards wellness together, and the patient can continue that journey after the relationship is terminated. I work inpatient, cardiac, post procedure intervention, open heart, and I feel that this is a great theory for me, but I also feel that this theory can be utilized in any aspect of nursing. For this theory, there are three phases: orientation, working, and termination. The orientation phase, during this phase, the nurse identifies herself to the patient. So I relate this to the AIDIT. The nurse is stating her status, purpose, nature, and time available for the patient. The orientation of the nurse to patient is mostly a one-way contact. The main focus of the nurse's attention is on the patient, listening, hearing what is said, and asking those who, what, where, and when type questions to stimulate the patient's descriptions and stories. So the patient is expressing all those emotions and needs, or just telling you stories just to kind of communicate and make those connections. The working phase accounts for the majority of the nurse's time with the patients. The nurse assesses the patients. The roles of the nurse become more familiar to the patient. They begin to accept the nurse as their health educator, resource person, counselor, care provider. So this is more of like a trust phase is how I can relate it. The working phase is broken down into two subcategories: identification and exploitation. The identification phase begins with the client works interdependently with the nurse, expressing feelings, and begins to feel stronger. The patient begins to have feelings of belonging and a capability of dealing with the problem, which decreases the feeling of helplessness and hopelessness. I relate this to your post-open heart patient who didn't even know that they had heart problems, and now they've had open heart with triple quadruple bypass, and they're realizing how this is going to affect their future. Maybe they have some regret of what they've done in the past. So this is this feeling of helplessness and hopelessness is true and it's real, and at this phase we can help decrease that. The exploitation phase, this is the point where the client makes full use of services offered. Use of professional assistance for problem-solving alternatives. So maybe we're thinking about when we go home, are we going to do PT/OT, home health, cardiac rehab? Are we going to do transportation set up for this patient? How are they going to get to their follow-up appointments? Maybe we have a wound vac and we need wound care at home. The individual feels that they are part of the helping environment, so they need to help make these decisions during this time. It's not just a, you're going to do this. Let them, come up with some of their ideas of their own. And they may make minor requests during this time. So maybe we're, post open heart and we need help getting out of the bed to the chair, but we can finish our ADLs by ourselves. The patient may fluctuate on independence. Some days are better than others. We have to take some things slow. Maybe we went a little fast one day and kind of backtrack a little bit, and that's okay. The nurse must be aware of the various phases of communication. Communication is my soapbox. I have had this in my previous discussions, and I will touch on that in a few slides, in the next few slides. The nurse aids the patient in exploiting all the avenues of help, and progression is made towards the final step. So we're getting near the end. The termination phase, this is the third and final phase. The completed work for the patient is done and the nurse-patient relationship is terminated. So this to me is my discharge. This is day of discharge. I've got everything planned and I'm ready to do this. The success of the termination phase is dependent on how well the patient and nurse navigated through the orientation and the working phase. Did we, make those connections really strong in the beginning so the termination phase is easier? The major part of the termination phase is when the nurse teaches the patients about symptom management and recovery at home. I try to utilize my AVSs and give my patients hardcore information and I really try to start day one if I knew they're going to be on new medicine, and we talk about it from day to day. But this is the time where we've taken all that information and kind of bundle it together in information for them to take home. The concepts that I have for this theory are health, communication, and environment. Health, the holistic concept of health, is contained in the expression of wholeness. Health is a relative state in which one is able to function well physically, mentally, socially, and spiritually to express the full range of one's unique potentialities within the environment in which one lives. I think this is a great quote. This is just, I'm going to have to use this for later. I have saved it. Communication. Here it is, my soapbox. So there's different avenues for communication. You have verbal, nonverbal, written, listening, and visual. I think that making that first connection when you talk to a patient really puts an impression on them. But not only is your verbal communication important, it's the nonverbal. Actions speak louder than words sometimes. So we really need to watch what we're doing. Some patients may require written communication. They need that hard copy information because they need to see it written down. So we need to keep that in our mind too. Maybe they don't like written. Maybe they like listening. Or maybe they need visual aids, printouts or booklets that have pictures in it. And you just be aware of what their needs are. Environment, surroundings or condition in what the person lives or operates. What are they going home to? Is the environment safe? Is your environment in the hospital setting clean? The environment will influence the growth and development of an individual. You don't want to send somebody home and then not grow forward with their health or it impede them and then come back to the hospital. Paplau's theory views on nursing. Paplau conceptualized clear set nursing roles. The nurse's duty is not just to care, but the profession encompasses every activity that may affect the patient's care. Paplau's concepts are generated towards psychiatric patients. She was a psych nurse. However, her theory can be applied to any person capable and willing to communicate. The phases of the therapeutic nurse client are highly comparable to the nursing process. The assessment coincides with the orientation phase, nursing diagnosis and planning with the identification phase, implementation to the exploitation phase, and evaluation with the termination phase. Oops, sorry. How does Paplau's theory apply to clinical nursing education? So I put a little check mark beside all of these. I believe that this theory does facilitate learning in the healthcare environment. I mean, this is where we're providing education to our patients. This theory demonstrates effective interpersonal communication and collaboration with interprofessional relationships. We are, communicating with multiple parties here for this theory. Apply clinical expertise in the healthcare environment. Yes, maybe we need to get those wound care nurses to come in and assist us, or maybe you're certified nurse in something and you're teaching them something you're certified in. Facilitate learner development and socialization. Yes, we are trying to further to develop our patients by providing education. Implement effective clinical and assessment evaluation strategies. Personal reflection. Like Paplau, I feel the patient and nurse must work together to form a plan of care. Their patient should be comfortable. Nurse should not judge. Communication is the largest tool a nurse can utilize. The lack of communication can alter or delay the plan of care. The patient should ask questions. Education and health promotion are my number one goal, and every patient should be provided with educational resources for health promotion at discharge.